know it's difficult in this environment with lots of changes and headwinds to actually improve the life of our providers. We knew that our providers were spending anywhere from 2 to 4 hours additionally per week just on electronic medical record completion. And I knew that there had to be a better way.
DeepScribe have been an amazing organization to work with. They really heard what we had to say as an organization around the need to customize the models for oncology use case, because oncology documentation is very complex.
I come into the room, I say hello, I put it down, and I forget about it. And it is literally just me and the patient, and I am focused and I am there. And then I walk out of the room, hit a little button, and I have a note.
DeepScribe is exquisitely attuned to the field of oncology. The team actually came into clinic and observed how we were interacting with patients, and then they developed customizations specific to oncology.
It is better than I expected. One of the issues always when you're in a specialty like mine is there's so much specialty language. So for example, the drug names, it captures the odd drug names, the ones I can't even pronounce. It captures those almost 100%. So I used to spend 2 to 3 hours at the end of a clinic day, just putting everything in. I now spend 5 or 10 minutes a patient.
The quality has been superior. That's part of what helps our physicians because there's not a lot of editing afterwards. They are able to pay more attention to their patients. They can have conversations without even thinking about what's going to have to be dictated, what's going to have to be remembered, because it's automatically capturing it.
When I see you, it will pick up our conversation, but also it will pick up the fact that you are on 2 diabetes meds and 3 high blood pressure meds and a hypercholesterolemia med. That is just great.
It's a huge benefit to our providers and streamlining documentation and giving them time back in their day, whether that be for utilizing that time to spend time with their family, or if they're overly ambitious, seeing additional new patients.
We have seen a tremendous change in physician productivity and physician well-being. We had a goal to have 20% of our physicians utilizing DeepScribe. That goal was blasted from the beginning. We've seen utilization rates of 70, 80, 90% in some of the regions. The physicians are seeing the value.
The quality of the note has been really incredible. Remember, in oncology, when we're dealing with cancer, we're talking about a wide variety of topics. It is a very involved conversation. With using DeepScribe, I don't have to focus on documentation and collecting those encounters on paper. I get to focus on my patient.